Hospice Home, Dr. Andrew Duda. Welcome to the show.
Morning. Thank you. Good morning.
First time here.
First time here.
Great. You've been in Jackson for about 10 years, right?
About 10 years now, yes.
Yeah. How do you like it so far?
Call it home.
Yeah, it's
Yep,
perfect.
It's wonderful.
Yeah.
The hospice home, what an asset to our community. It's a physical place that people that are in the last stages of life are cared for, and it's kind of hidden.
It is. It is. So hospice home is a part of our entire hospice program at Henry Ford. And it is a facility that's located just off of 127 Springport Road, west of the highway, north of Springport Road, about 3 blocks down the street. 20 beds, individual rooms, and just a gem hidden in the woods.
Yeah.
Beautiful surroundings.
Are there similar hospice homes in this area?
So the Henry Ford Hospice Home is actually the only non-for-profit hospice facility in this area,
Wow.
and one of the few left in the state.
Really? That's amazing. We're lucky.
Yeah, we are lucky. And you say 20 beds, what if it's fall, or what if someone doesn't want to leave their home?
So as part of the entire hospice program with our health system, we also offer both hospital hospice care and in-home hospice care. And that in-home hospice care can be at the person's home, if they're at one of our local skilled nursing facilities or assisted living facilities, that care is available to them there as well.
How's hospice care different from palliative care that someone might have?
Sure. So the common misconception is that they're very similar, and their similarities are really only focused on the time of life that they're given. That's about where they end. Hospice care is really focused on the last 6 months, maybe slightly longer, maybe less, of life, and really focused on comfort and dignity and just quality of life at the end.
Yeah.
Palliative services, which we also offer both in our community and in our hospital, are focused more a couple of years prior to that for the individual that might have a medical condition that is not going to get better and likely to cause them ER visits and hospitalizations, and they just don't want to do that anymore.
Yeah.
So they try whatever they can to stay out of the hospital.
It seems like you can have a very hard, difficult job at times. Obviously, I've been in some hospice homes and see what goes on there. Talk about the care that the families receive as well.
Sure. So yeah, death and dying is difficult. It is for everyone, and I think that focus and knowledge of our team and having their compassionate and caring backgrounds really helps. And our team is really what the patient receives when they come on hospice. We have our RNs, our registered nurses, who are there 24/7 at our hospice home and available 24/7 for our home hospice patients. Our certified nurse assistants, our CNAs, social workers, chaplains. Bereavement counseling is available during and after for over a year after the person passes for the family.
Wow.
What are some of the common misconceptions or concerns about this type of care?
So I think the big one is that you come on hospice and we make you die. And that sounds grim, but that unfortunately is not the case. The medical process that's going on is what's doing that. And what we're here for is just to help maintain comfort, help maintain dignity, and really do it with a true compassion that might not be available in other healthcare service lines.
Yeah, when my mom passed away last year, we signed up for hospice care toward the end, but there wasn't a place. There was one person who was responsible for a wide geography, and we had to wait. And it was, and you just don't realize how great we have it here, and that was in a big metropolitan area.
Yeah, for sure. It's important. What do you find most rewarding about your role in hospice care, Doc?
Sure. So the difficult nature of dealing with death and dying is hard, and seeing the team that we have provide care with such compassion and grace is just hugely rewarding. And I had this question's always asked, and I had a very very, very good mentor back in the day that told me once that he felt the only thing, or one of the things we did really well in healthcare, was take away the good ability to die or die well. And I think hospice really brings that back. It gives you the opportunity to rest, try to be comfortable. It gives your family the opportunity to be your family and not your caregiver, and really just focuses on you as you pass into the next stage.
It's a beautiful facility. It doesn't feel like a hospital setting. It's you've really made it feel very comforting for not just the patients, but the families.
Right.
So what is the experience?
So the experience, it can start really anywhere. It could start at home. It could start in the hospital. You can be referred by yourself or a family member. My job is to ensure that the medical condition the person is dealing with is terminal. And then depending on what your needs are and where you want to be and how you want to design this care plan for yourself, we either keep you at home and work with you there, or we bring you into the hospice home, get you into one of the 20 rooms. All beautiful views there. Our RNs are there 24/7 to take care of you. And I would be really remiss if I didn't mention a fantastic culinary staff that probably rivals some of your neighbors across the street here. So, but everything is there. Our chaplains play the guitar and love to sing. We've got piano going. It's a quiet facility. It's very peaceful, very calming.
You said you had a great mentor. I'm wondering, when you were in medical school, what path you thought you would go down, and if it would be where you are today.
So absolutely not. Those paths change quite a bit.
Yeah.
And that was one of the things my mentors always told me, was keep your eyes and ears open. You never know what you're going to come across. And this was a blessing that was handed to me a few years back by Dr. Lake, who was my predecessor in this role. And it's been truly, truly wonderful to be part of.
Well, we appreciate having the Henry Ford Hospice Home and hospice care in our community, and we appreciate you coming in today.
Thank you for having me.
Thank you.
It's a pleasure. I love what you guys do for the community.
Thank you.
It's wonderful.
Dr. Andrew Duda, Medical Director at Henry Ford Hospice Home. More of the Morning Show right after this.